We have medications that are basically the female version of Viagra. Why are we not talking about it? Why is this not the hottest selling thing out
Right.
there?
Yeah.
So I think too, we have such stigma around sex. Your sex life is a very important part of your longevity.
Hi, I'm Dr. Vonda Wright, and this is Hot for Your Health. Join us for conversations on the bleeding edge of science, health, and culture as we bring you tech innovators, thought leaders, and the movers and shakers who are transforming science fiction into your new health reality.
Hi, everybody. Welcome back to Hot for Your Health, where I am joined by a brand new guest, but whom I met last year. And it's just a joy to have met her. And you are probably going to feel this today, but Dr. Katherine Johnson has such energy, like bling. I mean, you're just so energetic and know so much about the field of precision longevity. And in fact, your companies are called Precision Medicine. You have 3 offices, 2 around Chicagoland. And I didn't know, but you also have an office in Naples,
I
which
sure
is
do.
not far from me now.
Mhm.
But you are an allopathically trained medical doctor and have really honed your practice to be focused on whole health and longevity. And I want to talk about that approach today and why you made a switch from traditional allopathic practice to this. So welcome to Hot for Your Health.
Thank you, Dr. Vonda Wright. I am happy to be here. I'm hot for all that you do. I am a podcast listener. And yes, we had the pleasure of meeting at a longevity physicians meeting back in New York. And I think we both felt this energy and passion and enthusiasm for the work that we do. And I came from academic emergency medicine. So I was teaching medical students and residents both at the University of Chicago and Loyola University. And my passion for teaching now is translated into very personalized consultations that I offer patients on a one-to-one basis in this precision medical care practice. And this is a practice where I've advanced my training into functional medicine, obesity medicine, age management medicine, menopause care. I'm one of these lifelong learners and a bit of a unicorn because I could afford to um, sort of abandon my clinical practice and pursue something very different because once I learned about precision medicine, which is, I would just say simply, the right treatment for the right person at the right time. And we know we're biologically distinct, so uniquely different, and the genetics impact this, the genomics, the expression of our genes. This is based on what we know with environment, diet, feeding, sleep, and certainly relationships. So I love to study this and then help each of my patients identify how they're aging, what the biomarkers of aging are, both from laboratory data as well as body composition data. And we really do what I call as a chart biopsy. And this
Mm,
is something I learned in academics too. Before you walk into the patient's room, you want to review the chart, get a sense of where do their biomarkers trend. What has been their health history? So before patients come for consultation to my practice, we invite them to share as much of their health history as they're willing to, have them fill out an extensive questionnaire that asks about their sleep, their faith, their relationships, their stressors, and also their supplements, their diets, um,
yeah.
so many, their purpose. And I think that's really important too. And we send a large comprehensive panel of labs that include hormones, inflammatory markers, nutrients, and of course, lipids. And we're looking at omega levels, we're looking at inflammatory markers, and I help everybody understand using data how they're aging. So it can be
Mm,
by insulin resistance, it can be osteopenia, sarcopenia, it can be inflammation, lipids, and then, of course, mental health, stress. And we know immune senescence, our bodies become less resilient. And so I think it's helpful to understand I'm aging at a different rate than you're aging. And when I can show you and teach you how you're aging, and then we can precisely add interventions,
mm,
therapeutics, then we can start really studying one person at a time. When I include this intervention, what change do I see? And so we create a precision plan for each person, and we create a scientific hypothesis of what's happening with the body at the time. And then we track and trend more data over time, and we keep making adjustments to the plan in the pursuit of what is optimal health. And optimal health, we have some pretty good ideas of where your metabolic markers should be, just like you see with bone density. Where is somebody, what is their bone density at age 30, And similarly, how good did we feel at a certain age, and where's the delta from where that is today? And how achievable might it be to get your blood sugar to those levels, to get your resilience showing up for you, so we can age with more strength and enthusiasm, and then share that message with more doctors and patients.
So when a patient comes into you, it's so thorough, and it's obviously not a 15-minute in and out opportunity, right? There's no way, right? So sometimes do people feel, because I'm sure you uncover so much, is there ever the sentiment of, oh my gosh, I have so much to work on? How do you help prioritize? First, we're going to do this, then we're going to layer on this. What is the way you think about that framework?
Yes, and really, we want to eliminate health-related anxiety and come to a place of empowerment by understanding. And my hope too is, as I explain what I'm seeing in the data, I'm listening to how the patients, especially if we have, longitudinal data, we can say, well, what happened to you here? Oh, I lost my job, or I lost my father. You can see the changes in blood sugar regulation or weight or something like this. And so I think it can be very validating and affirming. And then what we learn very well in emergency medicine is triage. So I just
Ah,
create a problem list with the
yes.
patient, and the problem list is shared. And this is all shared decision making, where I say, this is my inventory of the things I worry about for you, but I'm also hearing what is bothering you the most, right? And then how can we together create a plan where I'm literally prescribing feeding intervals, fasting intervals, movement goals, diagnostic, therapeutic goals, medications to consider. We don't always have to go to medications. If we're going to use a supplement, we're going to talk about what we're treating and why.
Yes.
And I have to say, I think what makes us good healers is we're good listeners. And when we listen very carefully, and I block at least 2 hours for the first visit,
Ah,
that's in advance of I'm looking through your chart for a couple hours before that and thinking about you. And I pull a file of handouts for each person that's specific and unique to them. So if I'm seeing somebody with iron deficiency, I'm going to have my handouts for iron. If it's osteopenia, sarcopenia, if it's cancer related, we do genetic testing. We do a lot of things where if you don't like all the data, you don't like needles, that's fine too. I can learn a lot about your health really just talking to you and listening to you. And that's, I think too, how we build trust, because so many people come to the practice and they've lost a bit of faith and trust in not feeling heard, and I also believe very strongly my mess becomes my message. I myself have congenital hip dysplasia. I've had a hip replacement. I've been 60 pounds heavier. I had a very messy perimenopause with endometriosis, adenomyosis, status post hysterectomy, been a mom, done IVF, so many. And
yeah,
also,
that you've lived through.
yeah, and you know what, I love that I'm stronger for it. It makes me a better doctor. I don't think younger people can just go into precision medicine and feel like they can crush it by just spitting out numbers with people. You really, I think, can do so much just by, I tell people I can be your coach, your friend, like having a doctor in the family. Um, of course, I'll be your prescriber.
Yeah.
But I'll be your partner. And I think that's what we've been missing in the traditional hyper-fragmented healthcare system. And I also, we build a team of specialists for each person. I call myself concierge precisionist. I'm doing metabolism, lifestyle, more of the integrative approach, but I still will probably need you to see and have a great cardiologist, GI doctor, orthopedic doctor, primary care doctor, and how as we get older, we know who we want on our team as a baseline because I can predict and medically forecast how you're aging. So if you have lipoprotein little a, you have familial hereditary hyperlipidemia, even though you don't have evidence of heart disease today, I'm anticipating it. So you're already plugged in, dialed in, and we're building that team of experts around you and for you and on your terms. So it's not an emergency. That's not triaged as urgent, but it is a plan we might have for 5, 10 years from now.
Well, I love so many things about what you said, but using the analogy of what you used to do in the emergency room, you're triaging because you're building the whole problem list, but it doesn't mean that 25 things have to be done today. You're saying A, B, and C. And I love that approach. It makes so much sense to me as another clinician because I think if people are just trying to DIY, which, lots of people try to read a book and do it yourself, and then with success or not success, or there's so many apps right now which are more like Quest Labs with an app attached, right? There's no priority, there's no human touch to that.
Mhm.
I love that skill and knowledge that you're talking about here, the priorities. But the other thing you just said, I also love is that you have, which I do too, but I'd like to understand more about, you have gathered around you a referral group of like-minded subspecialists. Have you had to do doctor education? Because so many doctors are trained in the disease care model, right? Not to prevent heart disease, but when you have it, we know what to do. So, how do you forge those relationships that are meaningful to your patients?
I think it also comes with experience. So I practice in my community. And so most of the people and doctors I know, I've worked with, they thought I lost it a little bit when I got into this. But
Now,
I think too, they see the work I do, they know my integrity, my character, and how hard I work with my patients, but they also see the results. Probably, Vonda, 20% of my panel are physicians themselves. And this is, of course, many people I refer to, they think what I'm doing is maybe not the right fit. But remember, whenever we put multiple doctors in the room, we don't agree. Our conferences are usually
yes,
very fervent debates.
yes,
And,
right.
so I
That's
remind people,
normal.
yeah,
Yeah.
we're not supposed to all agree. You want to get different perspectives from different specialists. And I want to hear and understand their concerns and also translate those for you. And then you can decide, So if your cancer doctor is feeling very strongly that you should take this medication that reduces your recurrence risk of cancer by 1 or 2%, but it's causing you all of these horrible side effects. Many times I'm hearing from the patient, I'm embarrassed to tell my doctor that I'm not taking it. I haven't been compliant. And I just say, they already know that. We know we don't always take what we're prescribed all of the time. And when something doesn't feel good, we want to know so we can help you understand how it's working, how we might have alternatives. And also, nobody wants you to suffer. But I do think often in conventional medicine, it's here's your prescription, I'll see you next year,
Yeah.
right?
Mhm.
You are in perimenopause when you're managing thyroid, we're biologically different human beings from week to week as women, and certainly from, a few months. And when we're doing aggressive strategies, if it's weight loss, if it's adding hormone replacement, I need to be in touch and trending data with my patients far more often. And so that's where a concierge practice like this and metabolic health, if you call it longevity medicine, you're just investing in your own understanding of your health. And wherever you go from there, whatever other doctors you see, you will be a more educated consumer. But every day I hear people saying, yeah, my doctor doesn't think I should do what you said. And I'm like, okay, I,
Well, And that's when a transparent, well-informed patient is critical, right? Because
Right.
I happen to believe that the smarter and more well-informed my patients are, the more compliant they'll be because they'll
Agreed.
understand, right?
It's so true. So
Yeah.
true. 'Cause then you understand why you're taking a certain molecule. And in my practice, when we're being preventive, we're
Uh-huh.
treating in the absence of disease. We're using therapeutics and interventions as preventive because if you have trouble with weight, you have insulin resistance, if I can treat that and keep your fasting blood sugar lower, your insulin sensitivity more optimized, I can prevent the 10, 15 pounds that you're expected to gain in menopause or perimenopause and with aging. So that's the goal is let's stay on the proactive preventive side of things. But of course, this medicine isn't for everyone because many people don't feel they need to have care unless they're sick. And
Mhm.
I do think that's something as Americans we might want to reconsider. We should have more health clinics than we do sick care
Disease,
clinics.
yes.
And so this is going to be a new trend where people are investing in their money that's not covered by insurance to see a return on that investment, just as they would if they were investing in their education or their wealth strategy.
Well, you know what? In the conversations I have about so many things, you're the first person who has talked about a societal shift in mindset because we often talk about an individual's shift in mindset. But what you said is very interesting is that because we talk about doctors being disease care, we're trained as allopaths, just because you and I happen to be MDs, in a pathophysiology model. So for us, the pivot of mindset to prevention, not waiting until a CPT code of disease shows up. But what you just said is so insightful. The American public themselves have to pivot their mindsets away from not waiting with blinders on until they're short of breath or something bad happens, but really seeking out the preventive side of this.
And remember, we don't have to do anything we choose to. And so I think too, how do we invite people to see that there is another side of being a physician where we've actually been talking about diet and lifestyle and please don't smoke so much, reduce harm. That's really how we're trained. But we have to be there when you're sick. And honestly, I'm a better doctor to keep you healthy because I know how quickly you can get sick and how precipitous that decline in health will be. And we want to compress that morbidity, especially if we can anticipate it. And
Right.
it's, I think, so empowering. And really, there's a lot of, especially the younger people, they're very interested in their health data,
They are.
and
Yes.
I also think too, I know so many people too, they don't want to go to the hospital because they're afraid they'll never come home. They're afraid of hearing bad news. When I tell somebody bad news, I frame it in a way of, listen, we all have cancer cells in our body. When I know where yours are and what protein they express, I can offer you a precision therapy for that. And I'm not going to walk around acting like you don't have cancer cells in your body right now, or do I? I do, right? I need my immune
All
system to be
do.
strong for it. And that's why we're going to take certain approaches of protecting our sleep, eating and nourishing our body with certain foods, and
Yeah.
trying to turn off those switches. And when I can test you for some of the genetic predispositions and remind you why doing preventive screenings will keep you from finding out about these things later. But I think it's a very binary approach, sick or not sick. When
Yeah.
I grew up, cancer, we couldn't say it. My grandparents had cancer. We weren't allowed to say cancer. It's fascinating.
Well, I love this whole approach and learning more about your approach to people. And I'm sure it goes without saying that because of the biologic complexity of women, your approach to women might differ than your approach to men in your practice. Am I assuming that, or how does that function for you?
Well, I think as women, we have been so tuned in because of our menstrual cycles
Mhm.
and often with pregnancy. And so Men tend to be they'll seek care either when they're having a heart attack or impotence, So I
It's so
think
true.
yeah, and so I think too, we do have some men who are worriers and they love the data, but most of the time, the practice is anchored with the perimenopausal woman with weight loss resistance, but then she brings us her husbands, her children, her sisters, her everybody. And when you experience the impact and outcomes that you can get with a precision approach to medicine, which will very much be the future of medicine, the NIH has been collecting our data. We have the tools, we just don't yet have the practice. But the reason I invest in my longevity is I want to be here to see it. I can't wait. So that when my grandchildren and your grandchildren are born, we'll know if they have Lynch syndrome, if they have BRCA, if they have, then we don't have to say everybody gets a colonoscopy at this age or a mammogram at this age. We'll have precision surveillance, tools, and we'll have more rapid data collection and trending. And that's really exciting. So
So when you do genetic testing, you're just talking about knowing things ahead of time at the genetic level and that's part of your practice. Do you sequence someone's whole genome? What are you doing?
So, and this is an important point because there are so many tests out there. They're direct to
Yes.
consumer tests. People will come in with their data. But what I'm looking for, I use the Invitae proactive panel. So this is where you actually have more monogenic or pathogenic genes that are known to be of concern, and you can actually take clinical action, right?
Oh,
So that's the genetics. And we know there are very few diseases that are one gene gives you one problem.
yeah.
Most things are polygenic. So the polygenic risk scores and the genomics are a bit more speculative. So I see those as a little bit of reading your horoscope, and maybe you were born in this month or you have this DNA sequence. Doesn't mean you're going to have a good day, a bad day, or that specific problem that is correlated. So I want to know the big deal issues. And so we can test for 163 genes. It's a $299 test. Any physician who's listening to this, you can get an account with Invitae. And you can create an account and you can start ordering these tests. They don't have to go through insurance, and you'll learn a lot about your patients. They also get genetic counseling with the service. I
Ah,
have
perfect.
tested other companies, and I haven't been that impressed that it's that actionable, but I'm keeping an open mind. I
Yeah.
myself test myself on a lot of things I'm thinking about ordering or including. But
Mhm.
when it comes to foundational, what's going on with you, we don't even start with the genetics, that's later. We
Yeah.
start with the fasting glucose, the fasting insulin, the lipid panel, the metabolic markers, the hormones, and the lipids.
I like your approach. It sounds a lot like mine because lots of people come to me. I have a very small longevity practice
Mhm.
in addition to my orthopedic practice. And sometimes people come having read something or heard something and they want to skip from, and the way I describe it is your health is fine.
Mhm.
It's not optimized, it's fine, you feel fine. But sometimes the bright, shiny object is actually some really gadgety, way in the future, non substantiated but I always try to refocus people on let's optimize first. And then it sounds like what your approach is we're going to optimize and triage. We're going to approach that. And then we're going to expand, never jumping ahead to, or maybe I don't want to put words in your mouth,
But
jumping ahead, because you
yeah,
can
we won't
draw
say never.
10,000 biomarkers. You can draw a ridiculous amount of blood and
Mhm.
it's not actionable. The key word that I loved in what you just got done saying is what you do is so actionable.
I think that's really in how we were taught fundamentally is why would I order a test if I don't know what to do with the results, right?
And yet
So
that happens so often to the public.
it does. And I see two patients will ask specialists or primary care doctors to order tests where the doctor says, I don't order that test. I don't know what you would do with that test result. And I suspect sometimes the person recommending that isn't always sure either. I find that when I look at a more integrative panel of markers, I get a pretty good look, but again, I'm also going back and I want to see the trend over time. And
Yeah.
that's really, I think, so helpful. And for people who haven't seen a doctor before, that's okay because we start building up that database. And I teach too, even if we don't have lab tests, I can learn a lot by taking your vital signs, taking a good history, your waist circumference versus your hip measurements. That these are important tools we can use even with a paucity of data. But then when we start adding data markers in, we can really say, oh, here's somebody who has higher uric acid. So they might be prone to higher blood pressure, gout, cardiometabolic disease. How modifiable is this risk factor when the patient has no symptoms, has never had gout or a kidney stone, has normal blood pressure, but it's running high. And it's especially worse when they drink alcohol or they eat a lot of sugar. How much can I modify that with lifestyle? And then if I start seeing end organ or other symptoms, when do we add treatment medication to keep you from having these complications that are known? And that's just one example. We could do the same with blood sugar, certainly with the hormone markers. You know, many people are saying, I want to have my hormones checked. Well, as a woman, they change a lot, but I do check the test because I like to show a woman your estradiol level around your period might be 20 to 40, and you could be having levels closer to 1200 during perimenopause. You can go what we call out of loop. So if you feel pregnant, you feel bloated, you feel tired all the time, it's the fluctuations that are so difficult for our body and can cause so many symptoms. So I think we can use data to inform and educate, but it takes time, and our system right now doesn't allow for time in the conventional. But I think with AI, we'll be getting there, and I'm excited for that too.
I agree. I think we can, insurance, obviously people listening know this, pay for 15 or 20 minutes. It's never going to be enough. But with AI, it sorts and prioritizes and it will make those visits more efficient. Well, we just talked about the actionable genetic panel that you use. You know, when I'm at longevity conferences, there are at least six I can name biological aging clocks. And I'm wondering, you've been in this field a long time. I've said out loud that at right now, sometimes I feel a little bit like they're party tricks. Or is it the trend? Do they really tell us anything? And they're all different. One's inflammation, one's glycation, what is your take? How do you synthesize what they do, their utility?
I mean, right now they're just in it's academic curiosity. So we don't have a data set that is reproducible, reliable, and correlates with any improvement in health outcomes. So
Yes.
from my perspective, they're not clinically useful. I've never ordered one. I've been curious about them. I'm listening, I'm paying attention. And when they say things like, oh, when we give women estrogen, her glycan age goes down by a decade. Okay, we already have so many published papers that show you're biologically healthier when you're premenopausal than when you're 10 years postmenopausal and not taking menopausal hormone therapy. The lipid profile changes, the immune profile, cardiovascular risk goes up, and 50% of women over the age of 50 are on blood pressure medicine. So I do think these are kind of fun, tests that
Right, right.
people are curious about. And, they're basically any direct to consumer test, you're contributing to the research and uh, aggregation of data for that company that in the pharma world, that company has to self-fund that research. They have to make investments in that research. So you might wonder, what are these companies that are saying, you buy my test, I'll give you some reports. We're not really sure what to do with it, but we have your data. And if we can do this with 1 million more people, maybe we'll see a signal.
And we'll
And
let you know. Right.
that's what they're doing. And I think if you want to contribute to research and development, go ahead and order that test. It's money.
Mhm.
That's what you're losing is your money.
Well, it sounds like we have the same perspective, and yet many consumers get taken in by the promises of, oh, this, I'm 58, but my bio age or glycan age or something is 31, and just that bright shininess. So I'm glad that of the perspective that, well, we don't know yet. It's not arrived.
No, but
What
we know grip strength, right? And we know how well to get
exactly?
up off the floor, get back up again.
We
Your
know
VO2
VO2 max.
max. I mean,
Yeah.
we have so many, I think your albumin is a major biomarker of health. Your GFR, your fasting glucose, your fasting insulin, your ApoB, I mean, your omega ratios, those are things I'm looking at. And I find more value. And I have actually telling, I'm doing precision medicine now. I don't have my patients asking me for those tests. They feel good. And if they didn't, they would know I would order a panel of tests that would be most likely to help find what's going on. And if I can't find it, I will do everything I can to figure it out with them.
Yeah. Is there a role in your practice, and when do you employ it? Uh, Peptides that are, and I'll tell you why I'm asking. Uh, in allopathic medicine, the gold standard is evidence-based, randomized controlled trials, and meta-analysis. Within the longevity world, as I feel, as long as we're transparent with people, that there is a trend towards evidence influenced, right? We don't have the randomized trials. And for some big categories like peptides, that's where they fall. What role do they play in your practice? What are the most common ones that you feel fill the gaps that still exist? How do you approach that?
So I think what you said is really important. And we have evidence-based medicine, which is quite dogmatic. And then we have evidence-influenced medicine, which is part of that hopium, trend
Oh,
we see. And then we have what I practice, which is evidence-informed medicine. And
okay.
that is that we do have data for some peptides that have been established to be safe in humans. And if it's safe in humans and it's used maybe in other countries for certain indications, you may or may not be a candidate for that. And we talk about the risks and benefits of that. Personally, I am doing so much foundational work for people before I would even add something that is beyond, so it could take quite a bit of time to get your insulin resistance addressed, get their body composition optimal, have good muscle, your lipids down, your inflammation down. I'm not going to have you take something that's less tested when we haven't even done the basics.
The
And
basics.
then when you're showing up and I'm running out of things to optimize, we'll be talking about, well, what can I offer you that may help you from a performance perspective, from, certain goals you have? Where is the data in humans, right? Because if it happens with a mouse or a flatworm, that doesn't translate as reliably. But there are molecules that have been in phase 2, phase 3 clinical trials. Then it's how you're sourcing it. And then what are we measuring to see that it's doing anything? Because I'll always validate your feelings, but I'm going to show you the data. And
Mhm.
so I think when it comes to peptides, we have seen a lot of whack-a-mole. Okay. So some of the,
Right.
peptide pharmacies that were around in 2018 shut down. And I do think it's a difficult regulatory
Mhm.
environment, and that also translates to disruption in patient care. So if I can source for you from a reliable source where I know you're getting something that isn't at risk of being gone if it's working for you, that's going to be part of your health too, because it's pretty traumatic to say, oh, you're on this regimen, but now I can no longer source that molecule for you. I don't like to practice that way. So, and I also find and just to remind the audiences, peptides are just signaling sequences that change the expression often of hormones in our body and repair pathways and immune signaling pathways. And just like we use insulin, this is a peptide, glucagon-like peptides, people know about
GLP-1s,
Ozempic,
yeah.
Mounjaro. So of course, I've been prescribing peptides for quite some time, and I've been going to peptide conferences for a long time, but I don't use them as liberally as many of my colleagues might
Mhm.
because I haven't haven't yet seen a case use for where I think I would add more benefit, but I am keeping an open mind,
Yeah.
and I really want my patients to know what they're putting in their body. So if I had a liquid chromatographer and I could run it and say, yep, this is molecularly distinct and equal to what was studied here that we know is safe, I'd
Mhm.
feel better. But even in compounding pharmacy labs where they have been regarded as safe, they're using molecules that are safe and studied. We've seen deaths with contamination, right? So, from those injections, steroid injections in preparation. So I think we really want to limit harm and be strategic. So people who want to come see a precisionist, yeah, we can run some medically supervised experiments
Yeah.
and explore together, but I also really value and honor health, and the molecular signaling of our body is pretty darn smart. So if I pull too many levers in domains that I don't know enough about,
Yeah.
I don't want to, perpetuate, as I said, we all have cancer cells. So why would I introduce growth factors in an environment that's not healthy?
Well, and I love that perspective because well, it's just how I practice. But also I live in a performance environment as an elite sports doctor where sometimes the hearsay is so powerful.
Mhm.
Oh, this dude used this or this. And then it almost overpowers the rational conversation. So I love this very rational approach that it sounds like we both take: health optimization, peak performance, and then maybe we pull in the less well known, less studied, when everything else, the stars all align.
And the data is coming.
Yeah.
You've seen it already with PRP, and I think too what we've seen with stem cells, right? It's you don't want to be pulling your mesenchymal stem cells from your ass when you're over 40 years old. Like that's not going to give you the results of if I have cord blood from a healthy woman. That's what stem cells are. They just haven't been allowed. So I think if we're seeing a shift in regulatory environments, then how do we make sure these are what they say?
Exactly. Are they?
We're in Florida. I know in Florida, we're going to see it first. And I say Florida already has enough grifters. This is going to bring a lot, and I think people who just want to capitalize on it. But I'd be wanting to say, do you have a microbiologist who's looking to see and make sure what
Yeah.
products are that you're
Knows what it is.
in my blood into an intra-articular space? What
Mhm.
are we doing? So there are ways to do it where I
Mhm.
think we will see regenerative medicine come next level. I'm really optimistic about it, but it's not yet, I think, in practice for most people. And how will we ensure that when we already have supplements aren't even regulated,
Yeah.
And I think that's something I was really hoping this administration would do more about.
Well, and there's so many supplements, I don't even know where to tell them to start, frankly. I was thankful I
Yeah.
mean, you had mentioned it off the air that we went and spoke for the FDA
Yes.
to just free vaginal estrogen, right? So I don't even know where they would start with the huge supplement industry right now, although some of them are so powerful, they probably could bear some regulation.
Agree. No, the supplement industry is billions of dollars, and the regulatory guidelines are not poorly. Are sorry, they're anybody can like start a supplement company and
Yes.
say this is what's in it, and they could put something else in it, whereas I use in source supplements that are third-party tested. So that's one thing to look for. If it's a fish oil, the International Fish Oil Society, my supplements would have a barcode on them, and you scan the barcode and you'll see how many parts per million of mercury is in that batch, so there are some supplement companies that will offer third-party testing, and I think that is good. A good manufacturing practice is also a good label to have. And so those would be the bare. And then I would say, well, what are you taking the supplement for? And is it changing, if it's vitamin D, is it changing your vitamin D level? And if so, at what rate and at what dose? And is that the right level for you?
Yeah. So in a very rational and yet curious manner, because I think traditional medicine has a lot to learn from the curiosity of people thinking outside the box, but clearly for the mostly women who listen to me and consumers, it just has to be buyer beware and not bright shiny object. And I know that's your philosophy too. What are a few things as we start to close that you're really excited about on the horizon? Because I know you do attend a lot of conferences and are on the really bleeding edge of what's to come. What are you most excited about in the next 5 years or so?
Well, in women's health, I'm most excited for the very moment. I'm so proud, Dr. Vonda Wright. You were there at the FDA commissioners, to make the case for why are we scaring women with black box inserts for a form of estrogen, where in my practice, I can say, I'm going to give you vaginal estrogen. I'm going to check your serum levels. I can show you it's not going to
The
be in your
rise.
bloodstream, right? And so that's a precision approach. But for most women, they don't know that. And they're so scared. And so that's what I'm most excited about is hopefully we get that black box warning pulled, because it was pulled for men and their testosterone. So let's
Yes,
do
it
this.
was.
Yes. And so also speaking of testosterone, I do think testosterone is a master hormone in women's health and how it can be supported
Mhm.
and replaced, where we should have an FDA approved option therapeutic for women. And I also think we can do so much more in women's health to say we have medications that are basically the female version of Viagra. Why are we not talking about it? Why is this not the hottest selling thing out
Right.
there?
Yeah.
So I think too, we have such stigma around sex. Your sex life is a very important part of your longevity,
Yeah.
just on your relationships. And I think too, if you are feeling dry, if there's pain, and that's keeping you from intimacy, first we can treat that. And the reason we treat it is because that intimacy, touch, and connection is so important for relationships, but also for your pelvic floor, right? And I
Yeah.
mean, women's bladders are literally coming out of their,
Yeah.
the amount of things and devices women are using to keep everything propped up when we can do prevention. It's
Yeah.
like you are, fixing all these joints and you're seeing the bone as butter. And I love how you say that because it's so true, is we lose this vital nutrient. Hormones are trophic, they grow tissue. So,
Yeah.
but we don't want them to grow tissue in the wrong place, just like, what are we feeding if we're overfeeding a body? We're feeding fat cells and cancer cells. So we want to have the right amount of replacement, if it's energy as food, if it's hormones, and every woman is very different. So I'm excited about those domains in women's health. I'm also very excited about how we will be seeing more injectables, glucagon-like peptides, and the next level of these. Obesity and overweight is a treatable, modifiable
Mhm.
biomarker that we can address, and we should be addressing it, because once we treat excess weight, we see blood pressure going down, cholesterol going down, risk of cancer going down. All of your organs are healthier. And I'm not saying be skinny or scrawny, I'm saying be leaner. And
Yes.
you can be leaner, but not always lighter. And that means that if I do body recomposition, where we lose fat, which is just squishy, but we get true muscle.
Mhm.
That's exciting. And I want to dispel a quick myth, and that is that when you're taking GLPs, you don't lose all this muscle mass, you lose water weight and lipodystrophic muscle fibers. Okay.
Mm.
But people, I see them every day. I've had people lose 100 pounds, 185 pounds is my biggest loser, if you will. And I remind them, you're strong. You carried all that weight around. You are
Mm.
scaffolded to carry heavy, and you're going to keep carrying heavy. Now it's going to be at the gym and you're
Yeah.
going to keep it moving. But, really, we have such stigma around weight, and it's modifiable, it's treatable, and it's usually your hormones. So if you're talking to doctors who say it's not your hormones, I would invite them to come to an obesity medicine conference.
Interesting. Well, I've loved talking to you and hearing about your approach in your precision medicine offices and as a longevity expert. So, Dr. Katherine Johnson, thank you so much. I can't wait to see you again, probably October
Yeah,
at
it's
the new meeting.
yeah, let's do that. And, really for all the other doctors and all the people listening, you can practice this way too. You can advocate for your health this way. And I think the work Dr. Wright is doing, I can't wait for your book too, is so important because I don't have the voice and presence she does. I'm working on it, but the more we talk about it, the more we make it accessible. So thank you.
Thank you. And thanks for being on Hot for Your Health.
Thanks for joining us on Hot for Your Health, where we bring you conversations from the bleeding edge of science, health, and culture. You can find links from today's show and connect with me at drvondawright.com. Don't forget to subscribe and leave a review wherever you listen to podcasts. I'm Dr. Vonda Wright. See you next week.